Hey everyone, welcome back to the channel. Today we're diving into a topic that might surprise you. You've probably been told your whole life that more health checkups are always better, right? We all grow up believing that the more tests we do, the safer we'll be. But here's the thing, after you hit 70, some common health screenings can actually do you more harm than good. That's right. Certain medical tests that were helpful in your 50s and 60s can start to bring more risks than benefits as you get older. And in some cases, they can lead to unnecessary treatments, invasive procedures, and a whole lot of anxiety without really improving your quality of life or your lifespan. So, if you or someone you love is in this age group, I want you to listen closely. Today, we're going to look at 5 health checkups you should think twice about after 70. I'm not here to say you should never get these tests, but I do want to help you have informed conversations with your doctor so you can weigh the real benefits and the real downsides before making a decision. Let's get into it. Full body scans without symptoms. First on the list is something that sounds super appealing, especially with all the ads promising early detection of cancer. I'm talking about full body scans, often done with CT or MRI when you don't have any symptoms. The idea is simple. If you scan your whole body, you might catch something bad early, right? But here's what many people don't realize. These full body scans can uncover what doctors call incidental findings. These are tiny spots or abnormalities that almost always turn out to be harmless. But once they show up on a scan, you can't just ignore them. Your doctor will probably recommend more imaging, biopsies, or even surgery just to be sure. For example, imagine a small nodule in your lung that shows up on a scan. It's probably benign, especially if you're feeling fine and have no risk factors. But once it's found, it often triggers a cascade of tests, follow-up scans, and in some cases, invasive procedures like a needle biopsy. Each step carries its own risks, including bleeding, infection, or exposure to radiation. And speaking of radiation, a full-body CT scan delivers a pretty hefty dose. In fact, the radiation from one scan can be equivalent to several hundred chest X-rays. That's not nothing, especially if you're repeating the scan year after year. Over time, that exposure could actually increase your cancer risk instead of lowering it. That's why most medical guidelines, including recommendations from the American College of Radiology and other professional societies, advise against whole-body screening scans in people without symptoms. The key word here is screening. It's different if you have new symptoms or a known issue your doctor wants to follow up on. But if you're over 70 and feeling well, a routine full-body scan is much more likely to cause stress and complications than to save your life. If your doctor or a private clinic suggests this test, don't be afraid to ask tough questions. What exactly are you looking for? What are the chances this test will really help me? And if they do find something, what would the next steps look like? Understanding the big picture is crucial before agreeing to any screening. PSA testing for prostate cancer. Next up, let's talk about PSA testing. PSA stands for prostate-specific antigen. It's a simple blood test used to look for early signs of prostate cancer. For decades, men were encouraged to get PSA tests every year starting in middle age. But we've learned a lot over the years about the downsides of routine screening, especially in older men. Here's why this test gets tricky after age 70. First, prostate cancer usually grows very slowly. In many cases, it never causes any problems during a man's lifetime. Especially in seniors, you're much more likely to die with prostate cancer than from it. But when a PSA test shows an elevated result, it often sets off a chain reaction, more blood tests, MRIs, and biopsies. And if cancer is found, many doctors recommend treatment even if the cancer might never have grown enough to harm you. Treatments for prostate cancer, like surgery or radiation, come with serious risks. We're talking urinary incontinence, erectile dysfunction, bowel issues, and a major impact on quality of life. For some men, the side effects of treatment can be worse than the disease itself. That's why the U.S. Preventive Services Task Force and other expert groups recommend that men over 70 skip routine PSA screening unless there's a compelling reason. If you're older and have no symptoms, the test is much more likely to lead to overdiagnosis and overtreatment than to save your life. Of course, if you have urinary symptoms or your doctor has a specific concern, that's different. But for most men in their 70s and beyond, it's worth having an honest discussion before getting a PSA test. Ask your doctor, if this test finds cancer, what are the chances treatment will actually help me live longer? And what are the chances it will cause harm? Those questions can help you decide whether the test is really worth it. Colon cancer screening with colonoscopy. The third checkup to think twice about is colon cancer screening with colonoscopy. Now, don't get me wrong, colonoscopy is an excellent screening tool for people in their 50s and 60s. Finding and removing polyps can prevent colon cancer and save lives. But here's what changes after 70. First, the risks of colonoscopy increase as you get older. The procedure involves sedation, which can lead to confusion or delirium in seniors. There's also a small but real chance of complications like bleeding or perforation of the colon wall. These risks grow higher in people over 75, especially if they have other health issues like heart disease or frailty. Second, colon cancer typically takes many years to develop. If you've been getting regular screenings that were negative and you're now over 75 or 80, the odds that a new, dangerous polyp will form and turn into cancer during your remaining years are relatively low. Most expert guidelines now say that people over 75 should talk with their doctors about whether continuing colonoscopy makes sense. If you're over 85, routine screening is generally not recommended at all. That's because the potential harms of the test often outweigh the benefits at that age. Mammograms for breast cancer screening. The fourth health checkup you might want to reconsider after age 70 is routine mammography for breast cancer screening. Mammograms have saved many lives over the decades by catching breast cancer early. For women in their 40s, 50s, and 60s, regular screening often makes sense, especially if you have risk factors like a family history. But when you reach your 70s and beyond, the equation changes. Here's why: as you get older, your overall health, life expectancy, and other medical conditions start to matter more when you weigh the benefits and risks of screening. Breast cancer can still happen, of course, but many tumors in older women grow slowly. That means they might never cause symptoms during your natural lifespan. At the same time, mammograms can produce false positives, areas that look suspicious but aren't cancer. If you've ever had to wait for follow-up imaging or a biopsy after a mammogram, you know how stressful that can be. In seniors, false positives are more common because breast tissue often becomes denser and more complicated to interpret on imaging. And if a small cancer is found, treatment decisions can be difficult. Surgery, radiation, and chemotherapy are much harder on older bodies, especially if you already have other health conditions. These treatments can also cause fatigue, infections, or hospitalizations that significantly reduce quality of life. That's why several medical organizations, including the U.S. Preventive Services Task Force and the American Cancer Society, recommend individualizing the decision to screen after age 75. If you are in excellent health and expect to live at least another 10 years, screening might still be reasonable. But if you have serious health problems or limited life expectancy, continuing mammograms often causes more harm than benefit. This is an area where talking openly with your doctor is essential. You might ask, if we find something on a mammogram, what would treatment involve? How likely is it that treatment will help me live longer or better? These conversations can help you make a decision that feels right for your values and your health situation. Cervical cancer screening with Pap smear or HPV testing. The fifth test to reconsider is cervical cancer screening. For decades, women have been encouraged to get regular Pap smears or HPV tests to catch cervical cancer early. This strategy has been highly effective in reducing deaths from cervical cancer in younger women. But after age 65 or 70, especially if you've had a long history of normal screenings, continuing this test usually isn't necessary. That's because cervical cancer takes many years to develop, and if you've had 3 negative Pap smears in a row or 2 negative HPV tests within the past 10 years, your risk of developing cervical cancer is extremely low. Continuing to do Pap smears past this point often leads to false positives, which can trigger further procedures like colposcopy or biopsies. For seniors, these procedures can be uncomfortable and carry a higher risk of bleeding or infection. Most guidelines agree that routine cervical cancer screening can safely stop at age 65 or 70 if you've had regular negative tests over the past decade. You don't have a history of cervical cancer or precancer. Your immune system isn't severely weakened. If you fall into that group, you can usually say goodbye to Pap smears without worry. If you're not sure whether you meet these criteria, it's worth having a quick chat with your healthcare provider to confirm. The problem of overdiagnosis. One of the biggest reasons doctors have become more cautious about screening in older adults is something called overdiagnosis. Overdiagnosis means finding a disease that never would have caused any harm in your lifetime. In other words, you might get diagnosed and treated for something that was never going to be dangerous. Here's an example. Imagine a tiny prostate cancer or a very slow-growing breast cancer in an 85-year-old. The cancer might never spread or cause symptoms. But once you know it's there, it feels impossible not to treat it. And treatment itself, surgery, radiation, chemotherapy, can carry serious risks that make your last years harder. This is why screening recommendations shift with age. When you're younger, finding disease early usually leads to better outcomes. But when you're older, especially if you have other health problems, the balance starts to tip. The likelihood that the test will lead to unnecessary treatments often outweighs the chance it will improve or extend your life. It's natural to feel anxious about missing something, but it can be reassuring to remember that many medical organizations now focus on high-value care, doing the tests and treatments that clearly improve your health and avoiding the ones that mainly create stress and harm. How to talk to your doctor about which tests you need. These decisions aren't always straightforward, and every person's health situation is unique. That's why it's so important to have open, honest conversations with your healthcare provider about which screenings still make sense for you. Here are some questions you can ask to guide that conversation. What are the benefits of this test at my age? What are the risks, including the chance of false positives and unnecessary procedures? If the test finds something, what treatments would I need and how might they affect my daily life? How likely is it that the treatment would actually help me live longer or feel better? What happens if I decide not to do the test? Doctors who specialize in geriatric care often use a framework called shared decision-making. This means you and your doctor talk through all the pros and cons together, then make a choice that aligns with your personal health goals and values. If your doctor doesn't bring up this conversation, you have every right to start it yourself. You can even bring a family member or trusted friend to help you remember the details. Why doing less can be the right choice. Many people feel that declining a screening test means giving up. But actually, it can be a sign of thoughtful, evidence-based care. Doing fewer tests doesn't mean you don't care about your health. It means you're focusing on the care that really matters, staying active, managing chronic conditions like diabetes or heart disease, and enjoying your time with family and friends without unnecessary medical procedures. When you shift your mindset from doing everything possible to doing what is truly helpful, you often end up with better health and more peace of mind. What about other common screenings? You might be wondering about other screenings like bone density tests, skin cancer checks, or eye exams. Here's a quick rundown of how experts generally view these tests in seniors. Bone density tests, DEXA scans. If you've never had a bone density scan and you're at risk for osteoporosis, your doctor might still recommend it after age 70, especially for women. That's because treating osteoporosis with medication can prevent fractures that seriously affect independence. So in this case, the benefits often outweigh the risks. Skin cancer screening. If you have a history of skin cancer, lots of sun exposure, or suspicious moles, regular checks can still be valuable. Unlike some internal cancers, skin cancer is easier to detect and treat early even in older adults. Eye exams. Routine eye exams are still important because they can detect cataracts, glaucoma, and macular degeneration. Conditions that can significantly affect your safety and quality of life. The big idea is this: not all screenings are the same. Some are high value and have clear benefits at any age. Others, like the 5 we've talked about today, become less helpful and more risky as you get older. The importance of personalizing your care. One of the most important takeaways here is that there is no one-size-fits-all answer. Your medical history, family history, personal preferences, and overall health all matter. For example, if you're in your 70s but in excellent health with no chronic illnesses, you may decide to continue some screenings. If you're managing several serious conditions, the risks of screening and treatment might outweigh the benefits. If you feel strongly about wanting to know everything going on in your body, that's your choice too. Personalizing your care means making decisions that reflect your values and priorities. It means understanding that in some cases, doing less can actually protect you from harm. And it means feeling empowered to have these conversations with your healthcare team. How to make informed decisions without fear. Let's be honest, these topics can feel overwhelming. Nobody wants to think about the possibility of cancer or other serious diseases. It's human nature to want reassurance that you're doing everything you can. But here's the thing: fear should never be the main driver of medical decisions. Instead, here's what can help. Ask clear questions. If you don't understand the reasons for a test, keep asking until you do. Request plain language. Medical jargon can be confusing. It's okay to say, "Can you explain that in simpler terms?" Bring someone you trust. Having another set of ears in the room can help you process the information. Take your time. Unless it's an emergency, you usually don't have to decide on the spot. Give yourself space to think it over. Consider your quality of life. Sometimes the right choice is the one that supports your comfort, independence, and peace of mind. Being informed doesn't mean you have to become an expert in every medical detail. It simply means you feel comfortable with the plan and confident that it fits your goals. What to do if you feel pressured to have a test. Occasionally, you may feel like you're being pushed to agree to a test you're not sure about, whether by a doctor, a family member, or even marketing materials from screening companies. If that happens, here are some phrases you can use. I'd like to understand the pros and cons of this test before I decide. Can you tell me what would happen if we don't do this test? What evidence shows this test will help me at my age? I need some time to think about this. Remember, it's your body and your choice. Any reputable healthcare provider will respect your decision to learn more and take time before agreeing to a procedure. Reframing preventive care in your 70s and beyond. So where does that leave you? If you're not doing as many screening tests, does that mean you're not taking care of yourself? Absolutely not. In your 70s, 80s, and beyond, the focus of preventive care often shifts. Instead of looking for hidden diseases you may never develop, you can concentrate on staying active and moving every day, eating nutritious, satisfying meals, managing chronic conditions like high blood pressure and diabetes, preventing falls by making your home safer, keeping your mind engaged through reading, social activities, or hobbies, tending to your emotional and spiritual well-being. This kind of care is just as important, sometimes more important than any test. A final thought, choosing what's right for you. To wrap up, here's what I want you to remember. The idea that more screening always means better health is an outdated myth. After age 70, it's okay and often wise to pause and ask whether a test still makes sense. The right choice is personal. It should reflect your health, your goals, and your values. You have the right to be an active participant in every medical decision. And you deserve care that respects your dignity, your time, and your peace of mind. If you ever feel unsure, consider getting a second opinion. You can also look for a geriatrician, doctors who specialize in the care of older adults, to help guide these decisions. Thank you for spending this time with me today. I hope this video gave you clarity and confidence about health screenings after 70. If you found this information helpful, please consider subscribing to the channel. We share practical guides every week to help you and your loved ones live healthier, happier lives as you age. And if you know someone who might benefit from this video, share it with them. Sometimes just having the right information can make all the difference. Stay well, stay informed, and remember, you have the power to choose the care that's right for you.